So we will talking about how to use this tracheostomy tube instruments. So what we will do, we have to attach a saline filled syringe, not fully filled, little bit, 2 to 3 ml of saline you take, and then you attach to this introducer needle, which will have a needle and the sheath. The sheath is above the needle, okay, over the needle. And now what you do, you place it vertically at the placing point over the trachea. That I will talk to you later. It is basically in the between the second, third, or third, fourth intertracheal space. In the midline, you go vertically and slightly caudal with the needle hub towards the patient's leg, that is caudally, and you, while going, you aspirate, you put a negative pressure. The time you get a air means you are in the trachea, then you, what you do, you take out the needle. Now you have taken out the needle, and the sheath is here only, okay, sheath is here only. Now you dislodge, you still have some saline in it. Now you again do a negative pressure. If still you are getting air, you are at the right place. Now you again take this syringe out. Now this is a J-tip dilator. What you do, again you just go like that, so that this dilator is towards the downstairs, like down towards leg. This, it should not be like this, it should not go here up towards patient head. It should go, this J strip should go towards the patient leg. So you have to just put this, see, it will go inside, the patient trachea and towards the carina, okay. So once it has gone, this is going inside, then you go till this, there is a, you can see there is a white line, till here you have to go, then you have to take this out. And now what you do, you take this sheath out, the introducer sheath out, you take the gauze piece, now you put it here. Now this is a pre-dilator, you introduce through this pre-dilator, okay, and you will go inside, and here there will be trachea. You have to, by a rotating movement, you go inside, okay, you go inside with a rotating movement. So you will go inside, and in this way you make a track. Now you take this out again. Now you have a preloaded, this is a preloaded Guidewire, okay, guiding catheter it is called. This is a guiding catheter, I will show you. This is a guiding catheter, okay, this is a guiding catheter over which we have loaded the single hydrophilic tapered dilator, okay. So it has also got a point below which it should not go. So at any point you should not leave your trachea, you just have to hold it. I was teaching you, so I was letting you know what is it, so that's why I have done that. So now again through this you introduce, go inside, and once you reach the skin, then by this downward motion you have to go smoothly inside, okay, and you make a track, okay. Once only you have to go, just like smoothly you go inside, downward, and you make a track. Then you take this Now when you will take it out, this guiding catheter will be in situ only. Now you will take this dilator out, and you have to deflate this cuff of tracheostomy tube, and with the help of obliterator you will put this again. Okay, now we'll go inside the trachea. Okay, and now this guiding catheter, the obliterator will come out together as a unit, and guiding catheter and even this guide wire, these all are inside the trachea. Now these all three things you have to take this out. Okay, you have taken out. Now you attach this to the ventilator after reconfirming its position through the bronchoscopy, here through the waveform capnography and 5-point auscultation. Okay, and you inflate the tracheostomy tube with 20 ml of air. Okay, so this is the way, and you attach it to the ventilator, you do a X-ray. So this is the way we do the tracheostomy.